easy medical notes. Now we will see abnormal heart sounds. First thing, there are two normal sounds heard by stethoscope, S1 and S2. S1 is due to closure of mitral or tricuspid valve and it denotes start of systole. S2 is closure of aortic or pulmonary valves. They are start of diastole. That is contraction and dilatation of heart. This S1 is onset of systole. It is usually single and due to closure of mitral and tricuspid valves. It may be loud in anemia, pregnancy, thyrotoxicosis, mitral stenosis, and soft in heart failure and mitral regurg. Next is S2. It is due to closure of aortic or pulmonary valve and start of diastole, or can say end of systole. It split on inspiration and is single on expiration due to closure of aortic and pulmonary valves. If it is wide splitting, it indicates atrial septal defect or delayed right heart emptying, that is right bundle branch block. Third heart sound, S3. It is in early diastole just after S2. It is low pitched and heard as a gallop. Many a times it is heard physiologically in young people and in pregnancy, and pathologically in heart failure and mitral regurg. Now the S4 is at the end of diastole or just before S1. It is low pitched. It is found in severe left ventricular hypertrophy. Systolic clicks. They are early or mid systolic. High intensity sound when the walls get stenosed or calcified or thickened. Even in prosthetic clicks, such sounds are heard, like wall replacement. Opening snap. It is in early in diastolic phase. It is high pitched and heard in mitral stenosis or severe mitral stenosis. There is an innocent or benign heart murmur which is soft mid systolic, heard at left sternal edge. There is no radiation or no cardiac abnormality specifically seen in young people. There is no treatment for it or no treatment required. How to assess a heart murmur? Its location, where it is heard, at which time it is heard, how loud it is heard, its intensity, grade 1, 2, 3, 4, 5, or 6, very soft, moderate, loud, with thrill, very loud, and heard without stethoscope. Then, where it is heard the most, at aortic, pulmonary, or apex beat. Does this sound radiate to neck, axilla, or back? And is the intensity constant or variable? In aortic stenosis, the murmur is mid diastolic. It is loud and best heard in left sternal edge, suprasternal notch, and carotids. For mitral regurg, it is pansystolic, blowing in nature, heard at apex and radiating to axilla. In ventricular septal defect, it is pansystolic, harsh in quality to hear, and in heard in lower left sternal edge, radiating to whole precordium. Benign or innocent murmur In mid systolic, it is soft, heard in left sternal edge with no radiation. To summarize abnormal heart sounds, they are murmurs, gallops, ejection, click or clicks and snaps, pericardial friction rip. Murmurs are due to turbulent blood flow through the walls or vessels. They are systolic, diastolic, or continuous murmurs. Systolic murmurs are between S1 to S2. They are due to aortic stenosis and mitral regurg. Diastolic murmurs are between S2 to S1. They are due to aortic regurg and mitral stenosis. Continuous murmurs, that is, throughout the cardiac cycle, murmurs are heard. It is due to patent ductus arteriosum. Gallops are extra heart sounds, that is S3 and S4. S3 are heard more in young females or in heart failures. S4 are due to stiff ventricles and heard in hypertension and aortic stenosis. Clicks and snaps, also called as ejection click. After S1, they are due to valve disease, aortic or pulmonary valve disease. Pericardial friction rub, they are high pitched sounds from pericardium rubbing against the heart. It is due to pericarditis.